Want to lose weight like them? Gastric bypass in Cancun can help. But how? With the help of Dr. Hector Perez. Certified by the IFSO and ASMBS, Dr. Perez has been trusted by over 10,000 happy patients. In this video, he'll answer everything from eligibility to recovery from gastric bypass.
It's a malabsorptive technique. What do I mean by malabsorptive? We're gonna make a smaller stomach for you, a new stomach, and what we usually do, we count your whole small bowel. Let's say a normal patient may have between 10 and 12 feet, but some patients may end up having 20 or 25 feet. So what we do is we count your whole small bowel and we bypass 35 to 40% of that small bowel. So it's a malabsorptive procedure because instead of absorbing 100% of your small bowel, you will be absorbing only 65%. Usually what patients are afraid of a malabsorptive procedure is that they don't want to have any nutrition issue. I can tell you that instead of doing the bypass the way we used to do it 10, 15 years ago, doing what it's called a fixed bypass, meaning you're gonna bypass 8 feet and that's it. Nowadays, we count the whole small bowel. So we make sure we're leaving enough small bowel for the patient to have good nutrition, but also to lose weight. So there's nothing to worry about a bypass being malabsorptive. Having your bariatric gummies or your bariatric vitamins, your proteins, you shouldn't have any problem. You should get to your ideal weight, go into remission into the metabolic disorder, and do very, very well. Any patient with obesity, again, BMI above 30, but ideally with metabolic syndrome. What is metabolic syndrome? Cholesterol, triglycerides, diabetes, high blood pressure. So if you have obesity and those comorbidities, the best option for you is a gastric bypass. In 1 hour and 1 hour and 20 minutes, we don't do any stomach removal. When patients had a gastric lift, you already had your stomach removed. And sometimes when we remove a band, the stomach is already harmed. So it's better to remove the upper part of the stomach to do the gastric bypass. But other than that, if it's a first-time bariatric surgery, we won't remove any stomach. And that's why, although it might sound like a very complex surgery, it's one of the few surgeries we do that it's totally reversible because you don't remove any stomach. So you can start fast walking on 2 weeks. You can start exercises 4 weeks. Gastric bypass have shown to keep the weight off 10 years in 80% of the patients.
MBS guiding you on your weight loss journey.